name is Jeana Konstantakopoulos. I had the pleasure of meeting Andy several years ago at a large healthcare conference we do here in the US called Health, and am thrilled to be one of your ecosystems. I'm going to just start off very quickly talking about Illinois and Chicago. For those of you who are not as familiar with the US, in the top right corner here, you can see where Illinois is highlighted. So we're smack in the middle of the United States. Chicago is the largest city within Illinois, and I'll tell you a little bit more about Chicago itself. We're an economic powerhouse. We're the fifth largest economy in the US. We're roughly the size of Netherlands. We are a research leader with over $16 billion spent annually with public and private expenditures, much of that in the healthcare realm. We have a very diversified economy. So in addition to healthcare, manufacturing, the restaurant industry, and food and agriculture are other industries that kind of work alongside us. And we have a really diversified labor market. We'll talk a little bit about the academic center that we are, but we have actually the second highest concentration of technical graduates in the United States, with 11 really large academic universities in our area. I won't I won't go too far into this, but really it's a great place to be if you're looking for a home in the US for many reasons, and part of which the standard cost of living is a little bit less expensive than cities like New York, San Francisco, or Boston. Matter itself is actually a healthcare incubator. We're a nonprofit, so we're set up with a mission to accelerate the pace of change of innovation. And we really do three things to help our mission. So we are a startup incubator. We've worked with over 1,000 startups since we were founded in 2015, and those healthcare startups are anything in the healthcare realm. We are disease state agnostic, we are technology agnostic, and we are stage agnostic. We take no equity in the companies that we work with, and we offer them services to really grow and accelerate. We're a community nexus. So we do a lot of programs. We do about 40 events a year. If you visit matter.health, you are all welcome to come join us for the many public events that we host. A lot of those advance thought leadership in a variety of different areas. We actually also have an office in a large landmark building in Chicago called the Merchandise Mark. If you are looking for a home away from home as you travel, please let me know. Our offices are open to you, and you are welcome to come visit. And last but not least, we work with really large organizations to help them innovate more efficiently. And we do that through a variety of different ways, both internally helping them advance ideas and concepts, and then externally by doing things like accelerators. A little bit more about kind of what our makeup is. We work with startups primarily in the digital health sector, but also life sciences, services, devices, and others. And our partners are well distributed. So some of them are hospital systems, some of them are large pharmaceutical companies, multinational global pharmaceutical companies. Some of them are associations like the American Medical Association and the Alzheimer's Association. Some of them are insurance providers, and some of them are university and academic partners. I think this is important because when we're talking about the US healthcare system and getting grounded in it, it's a very complicated, and you may have siloed kind of industry. And so having a network that includes perspectives across all of these different areas is really significant. And I think most significantly, it's evidenced by the success of the startup companies that we've worked with, who've raised in excess of $5.3 billion since we opened in 2015. Last but not least, I'll just give you a snapshot of the types of organizations that we work with. I think this helps to wrap your head around some of the groups. I know there was a question when we were working on the newsletter about women's health, or age tech, or oncology, or diabetes. And the answer is we work in all of these fields, and our partners are invested across a broad range of these topics. So if you have a particular interest or are looking for a connection, please reach out. We're thrilled to be part of this network in really advancing healthcare for all.